A very warm welcome to our hospital. I'm Sherwood McCaskey. As always, I'm pleased that you have joined us. Now, up-to-date and specialized medical equipment plays a critical role in enhancing patient care and treatment outcomes. By donating equipment to our hospital, you contribute to improving the hospital's capacity to diagnose, monitor, and treat patients effectively. Modern equipment can lead to more accurate diagnosis, safer procedure, and improved patient comfort, ultimately leading to better health outcomes. On Thursday, June 8, 2023, the government of China donated a special camera to the ophthalmology department here of our hospital. The Chief Operations Officer, Dr. Christine Greenidge, and expressing her gratitude, provided details on the use of this high-tech piece of equipment that will be of benefit to all of us.
It is truly an honor to have, once again, Ambassador, your presence here at the Queen Elizabeth Hospital, of which for many decades this government of Barbados have really enjoyed mutual respectful partnerships. But in particular, your efforts over decades in helping us here in Barbados to make a huge difference in the lives of people have something that I'm sure that the public is well grateful of, and we continue to enjoy that partnership. Over the many decades, we have exchanged medical teams. You've had many Chinese medical teams here coming to our country to assist us. We've sent many students to the People's Republic of China for educational as well as medical experiences. So for those opportunities past and more to come, we are truly grateful. Today's presentation of the Fundus camera is something that everyone, I think, that has an idea in terms of eye diseases in our country is something that we are truly grateful for. And just for the general public, what the fundus of the eye is just that part, or what we call the rear of the eye, the back of the eye, where often it is difficult without proper instrumentation to be able to effectively diagnose, upon diagnosis, screening, diagnosis, and then after diagnosis, the ability to treat the eye diseases. One disease in particular that we are very well aware that can cause extreme damage to the back of the eye is diabetes. That condition, being diabetic retinopathy, is something that is, if left untreated, can lead eventually to blindness. Another common eye disorder, glaucoma, the macular diseases as well, found in the rear of the eye. And the importance of this equipment for our ophthalmologists, I think, really is something that the public here needs to understand in terms of the timeliness of our ophthalmologists being able to properly screen for eye disease and therefore plan a treatment for eye diseases as well. There's no doubt that the presence of this high valuable equipment will enable our practitioners to meet the demands that they're seeing every day in the public with eye disease. So again, on behalf of the QEH staff, I thank you much thanks again for your continued efforts in helping us make a difference to our public and, of course, the people and the government of Barbados. Thank you.
The Chinese ambassador to Barbados, Wan Shuxing, describes the donation as a fine example of China's commitment to small island developing states, more specifically, its commitment to Barbados. He places the relationship between the two nations in perspective.
It is my great pleasure to attend this ceremony to present a Fundus camera to the Queen Elizabeth Hospital of Barbados. As remembered, years ago, almost at the beginning of the pandemic, Dr. Beskin and Mr. Ying Flicking came to the embassy to talk to me about the need of Fundus camera in this hospital to help early fight the disease. And the embassy is always doing this, making this possible today with the medical team of Chinese medical team and the Chinese government together.
Giving to our hospital is essential as it helps ensure healthcare access, drives medical advancements, supports patients and their families, improves infrastructure and equipment, promotes community health, and allows individuals to make a meaningful philanthropic contribution. Your donation can have a lasting impact on the lives of our patients, our medical professionals, and the community as a whole. And of course, this is welcomed and encouraged by our hospital and our island. In emphasizing his point, he provided statistics.
According to the World Health Organization, small island developing states account for 10 of the countries with the highest obesity rates globally. And these small island developing states always have the highest prevalence of diabetes among adults in the world. Studies have shown that annual Fundus examination and effective intervention measures for patients with early diabetic retinopathy can significantly reduce the rate of blindness caused by diabetic retinopathy. At the request of the Queen Elizabeth Hospital, the Chinese government have decided to donate a Fundus camera to help with early screening and timely prevention and treatment.
On May the 30th, 1977, China and Barbados formally established diplomatic relations. Yes, that was 46 years ago this year. Ambassador Wan Shuxing speaks of this wonderful association of mutual cooperation between the two nations. He cites examples.
Barbados and China have continuously enhanced political mutual trust, promoted the Belt and Road Initiative, and carried out fruitful cooperation in various areas, setting a good example of mutual respect, equality, mutual benefit, and common development between countries of different sizes. China has always attached great importance to its relations with Barbados and has always been a trustworthy friend of Barbados. Since the outbreak of the COVID-19 pandemic, President Xi Jinping and Prime Minister Mia Motley exchanged letters expressing enhancing the mutual support between our two countries. The peoples of China and Barbados have pulled together and jointly overcome the difficulties of the pandemic. China has provided assistance to the best of its capacity to Barbados, including donating 30,000 doses of Sinopharm vaccines and dozens of batches of urgently needed medical supplies, assisting in commercial procurement of 30,000 doses of Chinese vaccines, and carrying out experiences, exchange, or epidemic prevention and control.
Ambassador Wan Shuxing speaks of the medical professionals from China who have been incorporated very well into the system here at our hospital and those who will follow.
The medical and health cooperation between our two countries has been further deepened. Since 2016, there has been 5 Chinese medical teams with doctors and nurses working in Barbados Queen Elizabeth Hospital. With doctors and nurses and colleagues here, they have established good friendship with the hospital and the doctors and nurses here. And about 1 in every 10 Barbadian people have received medical services from the Chinese medics. And I'm looking forward the 6th medical team can arrive in Barbados as soon as possible.
Yes.
I hope the agreement between our two countries for dispatching medical teams will be signed at the earliest convenience.
The ambassador is optimistic of the future partnership and cooperation with Barbados.
The year 2023 marks the beginning of the full implementation of the guiding principles laid down at the 20th CPC National Congress. It is also an important year for the friendly relations between China and Barbados to enter a new stage of development. We are wishing to work with friends in Barbados to implement the important consensus reached by President Xi Jinping and Prime Minister Mia Motley on the phone call in 2021. Continue to promote cooperation between our two countries in key areas, including medical care. We will jointly pursue high-quality Belt and Road cooperation, advance the Global Development Initiative, and build an even closer China-Barbados community of shared future. Thank you.
Thank you.
Thank you all.
And of course, we remain hopeful. Healthcare systems, especially in developing states, often face financial challenges. Acquiring new equipment can strain the budget. By donating equipment, you help alleviate the financial burden on our hospital, allowing it to allocate resources to other critical areas of patient care. A thankful consultant ophthalmologist, Dr. Sherwin Binskin, in speaking of the use of this equipment, provides greater insight.
How did this all come about? Well, I think you heard before that Ian and I saw a need in our ophthalmology department for fundus photography with respect to diabetic screening. That's where it started at. We all know Ian. I want to say he's been a staunch supporter of our ophthalmology department. He also maintains a very close relationship with the ophthalmology team. And as the ambassador said, we, a year ago, went to the embassy to meet and discuss acquiring fundus camera in order to do and perform diabetic screening. So what is this equipment that we're on about? Well, as you heard, it is a camera that can take photographs of the back of the eye, which is called the retina. So this is basically a game changer in our department. We did have this capability quite a few years ago, but as you know, ophthalmology is a very cutting edge specialty, and we must upgrade every couple of years all of our equipment, otherwise we become obsolete. And in the area of ophthalmic photography, it's no different. So this camera will provide us with methods to take photographs, diagnose, and enhance treatment in our patients, not only diabetic patients. The camera enables us to capture high-resolution images of the retina. And as Dr. implied, it's the tissue at the back of the eye. Now, the images provide us with invaluable insights into the health of the retina, the optic nerve, and blood vessels. One may say that you can look into the eye and diagnose these conditions, but having a high-definition camera, and I've recently acquired one in my private office, it makes a big difference. You can actually take photographs of the retina. You can enhance those photographs with the AI technology that we have, and you can actually see a lot of pathologies that you may miss if you just had a glance through the slit lamp, because the slit lamp is a two-dimensional view, and obviously it's prone to human error. Now, the camera also allows us to document the progression of ocular diseases over time. By comparing images from different visits, we can track any changes and adjust treatment plans accordingly. This not only improves patient care, but it also contributes to our understanding of the disease progression, enabling us to advance our knowledge and develop better treatment protocols. Additionally, the camera enhances patient education and engagement. You can now take a picture of the back of the eye, show this to the patient, and discuss treatment options. And the patients actually appreciate this because they can now further understand their condition. By actively involving the patients in their own care, we empower them to make informed decisions about their ocular health, leading to improved outcomes and better patient quality. This camera is also able to take angiographic images. And it's a big word, but basically what you do is you inject dye into a peripheral vein of the arm, and that dye flows throughout the entire body, and we capture images in the eye. So you can see the dye flowing through the eye. From that flow, blood flow, you can make various diagnoses and conclusions based on the flow, whether or not the dye is leaking out into the retina, or whether or not the blood vessels are obstructed. We're presently not able to do these studies. Recently, we acquired another piece of equipment which can perform a similar test, non-invasive. However, the fundus fluorescein angiography, which this camera can perform, has been shown to enhance the other type of angiography, which is non-invasive. And fundus fluorescein angiography is still very relevant in the management of retinal vascular diseases today. So again, this camera is going to be very useful. The camera, moreover, can provide collaboration and knowledge sharing among healthcare professionals. You now have the ability to take images, network these images, and share them with your colleagues, various offices, even offices overseas. You can discuss diagnosis and treatment, because clearly you can network these images. It also provides a start in the establishment of a diabetic retinopathy screening service, which we badly need in this country, because for the treatment of advanced diabetic retinal disease entails surgery. But when you've reached that point, the retina is probably damaged to some extent. So if you screen for diabetic retinopathy at an early age, you can treat and prevent the advanced form of the disease, which is sight-threatening. So this camera would be very useful in terms of that. We hope that we can acquire a few more, Ambassador, and
Yes.
and get this screening process on the way. So in conclusion, the addition of a fundus camera to our ophthalmology department is a significant step forward in advancing eye care. Its ability to capture high-resolution images, monitor disease progression, educate patients, and facilitate collaboration empowers us to provide the highest standard of care for our patients. And again, I wish to thank the donors for this generous gift and all of you for attending this special event. Thank you very much.
As Dr. Benskin spoke, I literally got a tear in my eye in terms of what I know will be the biggest difference in the lives of so many here in Barbados. Ambassador, your surname is Xing. Its numerology is the number 8. And today being June 8th, I'm not sure why this particular day was chosen, but in looking at my surnames of Chinese, I found that out. I don't know if you're aware that your number is 8. And so on June 8th, we are indeed double grateful that you chose this day to do this magnificent. I'm just so overwhelmed in terms of the lives that it will change by this donation. So once again, thank you all. And thanks the efforts of Ian, Mr. Hinklin, and you, Dr. Benskin, and being out there, big and bold, I would say, to ask for something that both of you, as well as many of us know, is so badly needed. So we accept this with biggest hearts of gratitude.
I think Dr. Green is reminded me that today special 6 and 8. These 2 numbers are very lucky numbers in Chinese culture. Yeah.
Oh my goodness!
June is 6. 6 is for successful, smooth, and 8 is only for prosperity, lucky.
Oh.
These 2 numbers are very.
It's meant to be.
Very lucky numbers.
Yes.
Yeah. So you have chosen luckily.
Yes, and many people will be able to see and read more about those lucky numbers after treatment because of the Fundus camera.
Yeah. Yes.
So thank you.
This good lucky day will lucky to the Barbadian people for their well-beings.
Thank you.
In responding to its monetary value, a grateful Chief Operations Officer, Dr. Christine Greenidge, encourages more philanthropic efforts.
So in the proximity of 75,000 US, 150,000 Barbados, and I want to take this opportunity to appeal. The government of China has done this for us, but we have opportunities to do this for each other. So I will use this soundbite to make a general appeal. It may not be you personally at this time, but it may be somebody in your family. And generosity goes a long, long way. I think Ambassador here demonstrates that from lands far away. And our seashore right here and our people, we can make a difference. 150,000 Barbados dollars to get more people accurately diagnosed and treated as fast as we can.
We could not agree with you more, Dr. Greenidge. Donating equipment to our hospital is very important as it improves patient care, provides access to advanced technology, increases efficiency and productivity, facilitates expansion of services and specialties, promotes sustainability and cost savings, and has a positive impact on the community's health. Your donations can make a tangible difference in the quality of care provided here at our hospital. And of course, it contributes to a better health care outcome for all of our patients. I'm Sherwood McCaskey. This has been Our Hospital. The series continues next week at the same time.